This technology changes lives. It is a definitive treatment that gets patients off of long-term medications. And not only that, it gives them their life back. I have referred my own father to have this procedure done because we are tired of his life revolving around his symptoms.
I came across Glenn, and he had been on medications for a long period of time. He was still having symptoms. He wasn't able to sleep flat, couldn't eat the meals that he wanted, and chronically had just disrupted his life.
I had reflux for a really long time, starting in the late 80s when I started practice, basically. Heartburn was basically my symptom. A few years later, I was taking Pepcid or Tagamet or whatever I could get. First episode of esophageal spasm actually was pretty severe. Feels like chest pain. I was doing surgery. I started having the chest pain and I thought, okay, this is a heart attack, and looked around to see where I was going to fall when, during surgery, and I was trying to hurry and finish surgery before I had a heart attack. But it was just esophageal spasm. So I had a workup then, and that was my first workup was to find out that I had esophageal spasms, and that was like early 90s. A few years after that started the regurgitation at night, where I would have such bad reflux that it would come out while I was asleep, and I would aspirate and I would choke and cough for usually 2 or 3 hours. I had to eat early enough. I had to stop chocolate and spices and alcohol and carbonation, but the main thing was I could not eat late and lie down. I couldn't lie down after I ate. One of our favorite things to do now that I'm retired is to cruise. Prior to the surgery, occasionally we'd get a late dinner and I would be really afraid to eat anything, couldn't eat dessert, couldn't eat chocolate or anything for dessert, even though things looked really good. When I did, I would have the bad reflux in the night. I took Tums and then Pepcid, Tagamet, Prilosec. Then after Prilosec didn't work, Nexium worked great. Until 2017, I was taking pretty big doses of different H2 blockers and things like that.
You just never know when you have reflux how dangerous it can be.
Other people had told me about people that died from aspirating from reflux, and my reflux was severe enough that I really felt like that was a possibility. I was thinking of the surgical procedures, and then my daughter started working for LINX, and she knew me, and she knew that that was something that would really help me. Once we talked with Dr. Leeds and saw it and played with the device, and it was a joint decision, my wife and I and Hannah, that made us decide to do that. I had the LINX procedure about 7 months ago, and the preparation for it was a swallowing study to make sure that I would be able to open the device when I swallowed it. I had a hiatal hernia. I was a little worried that they wouldn't be able to fix that, and they'd have to open something, but he did it all with a scope, put the LINX in, fixed the hiatal hernia, went home the same day. I had some pain medicine, which I may have taken the first night, but after that I didn't feel the need at all. Now, when I eat badly or eat late or eat spicy or whatever, it doesn't affect me at all.
We fix his hiatal hernia and give him a LINX, and the guy's, loving life now. I mean, he sleeps better, he has more energy through the day, his quality of life is drastically improved, and we have data to support that.
It's so much more relaxing not to have to worry about, if dinner's ready on time. We still try to eat early, but it's not really a question of life or death if we eat after 5:30.
On a recent cruise after the surgery, we got booked somehow every night for 8:45 dinners. I don't particularly like to eat late anyway, but now at least I could eat, and I could eat whatever I wanted and not worry about waking up with the reflux, because I don't have it.
He has just kind of exemplified exactly how patients are before surgery and then how they can be after surgery.